I love it. Every day my job is so rewarding because these are people that just really appreciate the care. They're just so grateful for anything you can do for them. And though my part might be little, I feel like I help them in a really big way.
When I became a dentist, that's what I felt the reason I was becoming a dentist was to provide a service that's important to the community and to society in general. So I believe that with Mountain Family and Rifle, I think we're doing that.
It makes me feel really good that I could take the information that I've learned and sort of help the community that I consider my family.
We're one community, and so if a group of our community is unhealthy or is not being served, then it affects all of us. For instance, if some of our kids are not getting their medical needs met in school, then that affects their learning, and then that affects what opportunities they're going to have later on.
It's important for me to provide the level of care in the future that they deserve, all the community members. The importance of the safety net clinics has been emphasized a lot in our program because our program and our profession is really focused on primary care. So I think the fact that CHC has such a great presence in Colorado is really important, and it can make such a huge difference in the lives of the patients that really don't have anywhere else to go.
There are so many different ways people are disenfranchised, and there aren't very many of us who could say that we don't have some obstacle, and so I can empathize with what goes on for people. Removing access barriers is something that I would want to have, and so it makes me feel good to be able to provide that for people.
I'm a physician assistant with Rocky Mountain Youth Clinics, and so we're a nonprofit pediatric clinic. We're a safety net clinic in the Denver metro area. There are so many families who, for so many reasons, have lost their insurance because of job change, or their Medicaid has lapsed, or their CHP has lapsed, and so if they become ill, or if the kids want to play sports, or getting kids ready for preschool, they need to have certain things in place in order to be eligible to do those things. And those things bring about opportunities for the kids too. So it's a place where they can go, where families don't have to worry about the financial need, and they know that they can get their medical needs met in a quality fashion.
I work at Craig Mental Health in Craig, Colorado, and I'm a clinician. I like the smaller town and kind of the hardy people that are there, ranchers, and the stigma that comes with mental health, especially in that population, coal miners. So I really appreciate that when they come in and go back and talk to the fellow workers, and then I can help kind of destigmatize.
Well, there's a lot of populations out there who they're underserved, yes, and therefore they also have a lot of medical conditions, and they have a lot of oral health needs too. And because of the profession I'm in, I know how important it is to maintain oral health, so I felt just kind of a calling to this population.
I was excited. I felt like, I'm going to heaven. I'm doing something good, right? Even if I'm just recruiting, if I'm bringing these providers to serve our population, serve our clients, serve the people in need, I feel good because I know what I'm doing it for.
The loan repayment program is really attractive to me because it's giving me a chance to work in the area that I want to work in, and at the same time easing some of the financial burdens.
I paid on my student loan for 13 years every month, and it was overwhelming. And so yeah, it was a huge relief, huge relief. I'm extremely thankful for it.
I think it actually means that I could stay where I live. Because sometimes in that small rural community, things get tight, and so you have to start thinking, well, I have in my past, about moving into the city where there's more opportunities. And so with this sort of funding, I guess it really sort of eases the burden for me to stay.
It meant a lot to me because this is actually not my first career. I worked my way through college to begin with, paid back that loan on my own, and so deciding to change careers later on in life was taking on quite a big debt. So to be able to find out that doing the work that I do, that I like doing, that I was already doing, would also reward me by absolving me from the worry of that debt was really a big bonus.
It meant a huge burden off my shoulders financially, especially for like the future, and made it maybe a little bit easier to just be comfortable where I'm at. So that was a worry, that I wouldn't be able to pay my loans but still be in this profession that I love.
The cooperation, events like this where you get to meet everyone and you get to see what everyone is doing, it gives you ideas, and it gives you the support that indeed, you're not alone, and we're providing this mission together, and not as one individual clinic that's outlined. We're together in this, and that gives you great motivation.
I do love it. I've been with Rocky Mountain Youth for about 9 years now, and it's been a real blessing. They're great families, and it's a really wonderful place to work, and very fulfilling.
Seeing the appreciation people have for what I do, and knowing that based on some of the outcomes and some of the feedback from the providers, that it really does make a difference.
You go home and you feel good. You feel like you're doing some good. We're just helping people who really deserve and need that care.